Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of ureteric duplication. So, clinical features of ureteric duplication are most of the patients in the ureteric duplication are asymptomatic. If you see, but what is the most common presentation? Mostly they are asymptomatic, but the most common presentation seen in symptomatic patients is it is persistent and recurrent urinary infections can be seen in most of the cases. Then in females, the upper pole ureter is ectopic. See, the upper pole ureter in the females is ectopic and it is also associated with ureterocele. So this upper pole ureter in the females is ectopic and it is ectopic and it opens distally into the external sphincter. And the opening is distal to the external sphincter. If the opening is distal to the external sphincter, or if it might even open outside the urinary tract, in such cases symptoms may be seen. Like for example, okay, it's simple. See, the upper pole ureter. So in the ureter, this is the kidney. The upper pole will drain downwards caudally and medially to the lower pole. Okay, now the upper pole ureter will drain caudally and medially to the lower pole ureter. Now whenever there is this upper pole ureter, if it goes and drains below the external sphincter. So this is the bladder, and then here you will see the external sphincter. So if it goes and drains below the external sphincter in females, so if there is no external sphincter, then there is continuous dribbling of urine will occur, right? So the patient will present with symptoms of incontinence is seen in these patients. So because of these symptoms of incontinence is seen in these patients, so because of this the patient will have constant dribbling of urine is seen along with normal voiding pattern. The normal voiding pattern is because of this lower pole ureter. The lower pole ureter is going and it gets inserted into the bladder at the normal position. So through the lower pole ureter, the bladder will have constant normal pattern of voiding, whereas from the upper pole ureter there is constant dribbling of urine is also seen. So this is what happens in the females. Then in males, if you see, now in the males, if you see, in the males, because the mesonephric duct becomes the vas deferens and the seminal vesicles, the ectopic ureter is always proximal to the external sphincter, and as a result the incontinence which we have seen here will never occur in males. So in males there is never incontinence is never seen in males, because the ectopic ureter in males is always proximal to the external sphincter.
thank you and thank you for watching.